Hello, this is Dr. Gay from First Look MRI, and this is a 60-year-old male with complaints of pain in his third finger, the tip of his third finger, beneath the nail bed. He has a palpable abnormality and pain, and we really can't see anything on this view, but just to get the anatomy down, this is the third finger, this is the index finger, and the lesion is right here in the region of the nail bed towards the index finger. Now if we put up a T2 weighted image that has fluid bright, it'll stand out. This has a little bit of motion, but if we go to the cut right there, we see it really jump out. So this is a small benign lesion, typical location involving the dorsal aspect of the distal phalanx, and we call this a glomus tumor. So to get the anatomy down here, here's the distal part of the finger, the distal phalanx, middle phalanx, proximal phalanx. We can see here that the patient has a flexor tendon on the palmar part that is intact, makes the finger flex. The extensor tendon is smaller back here, a little bit harder to see. We see this little area that looks like fluid, but again, this is a benign, we call it a hamartoma. It's a benign tumor of the nail bed, and there's something there that autoregulates the temperature. It's a little vascular shunt, arteriovenous shunt, and that shunt does regulation of the temperature, and sometimes it can develop a benign tumor which we call a hamartoma. It'll look just like this, typical location. Sometimes they can be larger than this, and they can erode the underlying bone. They can have erosion and scalloping and sometimes marrow edema, but this is again a really classic case of a hyperintense T2 weighted lesion, subungual, which means beneath the nail bed, the distal phalanx, and again this is pretty classic for a benign glomus tumor. Thank you very much.